Well, I guess welcome to the practice.
Thank you.
Welcome to our podcast, by the way. We've never done a podcast. This is not a podcast.
The podcast that wasn't going to be a podcast, but now it's a podcast.
Yeah, for the next 4.5 hours, lock in.
Oh my God,
we're going to be
Huberman,
yeah.
Joe Rogan.
Yeah, it's a human Joe Rogan combined podcast to have everyone in the world listen to us. Well, welcome to the practice, I guess. This is me trying to be a podcast host and it's not working very well. Tell me a little bit about your story.
Okay, so I came into chiropractic, interestingly enough, as a young child. I had torticollis, so for those of you who aren't aware, that's where the neck is sort of stuck in one position. It's also sort of commonly known as wry neck. And I must have been about 9 or 10. And my mum took me to a chiropractor, and it was the most terrifying experience ever in the universe. I remember, I don't know if you know those old Muppets chiropractic posters where it says chiropractics for the whole family. Yeah, one of those was on the wall. Anyway, the chiropractor that I saw, very well-known chiropractor, very good chiropractor, but just not great with kids. And although the torticollis resolved and, obviously I was a lot better for it, it was a terrifying experience. I never wanted to go back. My mum was a great advocate of chiropractic though. She saw chiropractors from a wellness perspective. And so when I was a teenager, I developed a prolonged concussion from a surfing injury. So I knocked myself out on the surfboard and I was sitting in the reception area, surly teenager. And Mum, I didn't know, but she'd booked me an appointment. And so the chiropractor came out and he said, all right, you're up next. And I was like, get away from me, witch doctor. You're not coming anywhere near me. But nonetheless, I went in and had a really profound experience. So my health history, I'd been that kid that couldn't breathe very well. I was a chronic mouth breather. I had really crooked teeth. I had chronic rhinitis, runny nose. I had asthma, I had all of those health issues, which I remember as a child getting CT scans and ENT scopes and the rest of it. And no one really kind of came up with any sort of plan for actually resolving that underlying issue. And I started seeing this chiropractor, initially because of the prolonged concussion and the symptoms associated with that, which they started to slowly resolve. But what also happened, this chiropractor was an SOT chiropractor, so that's sacro-occipital technique. It's just one of the many different techniques within chiropractic. And it made such a profound change, not only to the symptoms that I presented with, but actually to my overall health and well-being, my outlook. And I remember talking to my chiropractor about the fact that I wasn't sure what to study when I finished high school. And he said, why don't you look at studying chiropractic? And I was like, oh, actually, I think I might. Because I went from being, this child that couldn't breathe very well, couldn't breathe through my nose, to being able to breathe through my nose. I went under what's known as chirodontics care, which is the combination of orthodontics and chiropractic to get optimal outcome with jaw growth and airway growth as well. And I went from being a relatively average athlete to winning national titles and kayaking and doing really well in a whole lot of multi-sport. And it really did have that profound life-changing experience of seeing a chiropractor. So yeah, I went and studied chiropractic at New Zealand College of Chiropractic. Yep.
Hell yeah.
Yeah. And
go the All Blacks.
Yeah. And I went in thinking I was going to get into sports chiropractic because I was an athlete at that time and I was really into sports. But what happened is I got really interested in care of children, particularly because of my experience as a child of not being able to breathe well, having ADHD, all of those things that were a challenge for me as a child. And I started to see it in sort of other areas in life. And I thought, oh, okay, I'm kind of interested in paediatrics. So I started to look into that a little bit while I was still at Chiro College. And when I first graduated, and then I had my first child. And she had significant challenges. So tongue tie, torticollis, plagiocephaly, colic. She had the plethora. And I realized I knew nothing in terms of how I could show up and serve her with my chiropractic skill set, even though I'd already done some pediatrics. So that then kind of gave me that tragic backstory and the drive to be able to go, I need to know more. I need to know everything I possibly can to be able to show up not only for my own daughter, but I was starting to see this in my community as well. So some of these similar things. And at that point, that's over 17 years ago now, that there wasn't the availability of people that understood that whole picture. Like you might have potentially a lactation consultant that could help you with one aspect, or you might have like a dentist that could help you with another, or a GP that could help you with another. But there wasn't really any healthcare providers that looked at, okay, well, what's the underlying kind of challenges that this child is having that's inhibiting their natural innate health expression. And so that's what sort of drove me into doing a lot more of the airway focused, cranial focused, and so, 2 postgraduate things after that, and 2 more children. It's fun. The more that I find out, the more that I learn, the more that I know that I need to learn more. It's given me skills and passion to be able to show up and serve my community. So originally in New Zealand, and since being here in Newcastle, the families that I see, they've often, and you would see this as well, they've often gone to everybody else before they come here.
Yeah.
And they haven't had answers, or they've had like kind of very isolated answers about things, but there's not necessarily been someone that can tie that all together in a really holistic way. And that's what I love about what we are able to offer families as chiropractors.
Yeah, I that's actually very similar to a lot of my story as well. Like I was a colicky baby. My understanding of what my mum explained was, I was a colicky baby. They tried everything under the sun until they brought me to a chiropractor, and that kind of resolved. I slept through the night, and to the point where when my sister was born, that was the first person that they went and saw.
That's so cool.
And then, I had a similar experience going through high school. I crashed a car, knocked myself out, didn't really realise it was a concussion, but I was already going to go to chiropractic school because the chiropractor that I grew up in his office was just so onto it. And I remember being like 14 or 15, and he goes, "We've got a career evening. Why don't you come along and see if it's for you? I think you'd make a good chiropractor." And I was like, "Oh, that's a great idea." Because I remember we would go as a family to the chiro, be like a Thursday evening. I'd played soccer. We used to play like a game of soccer on a Thursday night for the school. And then after, we'd go to the chiro. And I remember having more energy or life, like life force, I don't know what you'd call it. But yeah, more life in my system after that adjustment than starting the day. And I always thought, oh, well, this is exactly what chiropractic is. This is how it helps people. And then you come out into the wide world, and there's back pain, neck pain, headaches, where my understanding has always been about the vitality of the human and
it's
having them.
Human potential, isn't it, really? Yeah, the chiropractor I saw as a teenager, that was his little tagline underneath his business name was Unlocking Human Potential. And I've really liked that. I've always thought that's what chiropractic is. That was, once I'd kind of got over the childhood experience with the chiropractor that didn't necessarily relate to a child well. That was another really important thing for me, and was being able to relate to children and meet them where they're at, so it's not a terrifying experience. Yeah.
Well, it sounds like that early interaction with chiropractic has certainly shaped how you practice now. How's that? So.
Yeah, absolutely. There's no hate on the chiropractor, but it wasn't communicated to me as a child very well, which made it a really scary experience. So although there was that like physical aspect of being able to adjust the subluxation that was met, I wasn't met as the human being.
Yeah.
And I think that's what is different about people like you and I who have actually decided to really work with these families and children as people where they're at, not just, we're just adjusting subluxations, this is just physically what we do. We actually take into account the bigger picture, we're relating to the child, we're connecting with the family. That was really important for me because that didn't happen when I was younger, which meant that I had this big gap in not receiving chiropractic care. So it has probably driven a lot of what I now focus on doing as a practitioner. It's not just about having a skill set, it's being able to communicate the why to the family, to the child, so that the child is understanding of what's happening and we're respecting that child as a human being. It's not just, I'll just get on the table and we do this, this, and this. They're
See you
screaming the
later.
whole way through it. It's like, no, that's not a healing experience. It's not a healthy experience. It doesn't kind of create trust, which is an important part of that healing journey. Yeah.
It'd be similar to how many people are petrified of seeing the dentist, right?
Yeah.
Yeah, I'm sure that there would be kids that we've terrified as chiropractors throughout our life that would never go back to a chiropractor.
Yeah.
And my partner, she's shit scared, or she's terrified of seeing a dentist, and they do the tick. They literally, at the top of the dentist's tick,
Yeah.
a box saying if you're terrified of seeing a dentist. And
Wow.
that's, I don't think we're going that direction. I think we're going quite the opposite.
Interesting. Do they do anything to I guess, check in about that? Or is that just a box that's checking so that the dentist is like, oh, it's one of those ones? Or
Yeah, well, I think they then actually provide extra care and attention to that person, which, no offense to dentists, is kind of the bare minimum standard of being a human and having, good bedside manner.
Yeah, it's interesting. I follow, because of the work that I do in sort of orofacial development, which is about facial development and airway development. I follow quite a few paediatric dentists, and they're kind of trying to do similar to what we're doing about looking at that kid holistically, making it an environment that's really welcoming for them, that they're excited about going to the dentist. They're like, yeah, I get to go to the dentist, like reframing and, changing the narrative on that. Like I love it when a child comes running in and they jump up on the table because they're so excited about getting adjusted. They're just like, oh, makes my day. But sometimes that can take a little while of building trust. But it's nice to be able to see that there's other professions doing the same. I get inspired and take notes from what they're doing as well in order to be able to create that safe environment for something that's kind of been a little bit stigmatized. And my experience, and there's been probably loads of other children that have had that experience. Like I remember when I was learning some of the pediatric stuff, there was this like idea that you just ignored the child's distress and kind of did the adjustment anyway. And it's like, oh, no, we're missing the mark there. So I think that we're changing the narrative about normalizing, like your experience with your sister. You just go to the chiropractor. Like that's a normal thing. You get your teeth checked, you go to the dentist. You get your spine checked, you go to the chiropractor. Like it's very normal. And I think changing the narrative about that it's not scary and it's not overwhelming and it's not dangerous is really important.
Yeah. One of the stigmas that I'm aware of is the word holistic as well. It seems to be a really easily throw-outable word. And sometimes it just describes something natural. Maybe it's looking at the whole body and how the whole nervous system works. Sometimes you can have holistic financial advisors, you can have holistic dentists, you can have holistic shops. What is holistic in your view, and how does that apply to chiropractic and how you serve people?
Yeah, it is a very generalised term, isn't it? I think the way that I look at it, it's that it's the opposite of that reductionist approach. So a reductionist approach is when you see a specialist about something, right? Yeah. That they will look at that one thing almost to the detriment of every other thing that's connected to it.
Yeah.
But the way that, like in chiropractic and the way that I view the human body is that we are a closed kinematic chain, right? And I can go really deep on this in terms of quantum physics, but we are, there isn't something that you can affect in one area that it's not going to affect another area. Yeah. So we can't be really reductionistic about how we approach health and how we approach chiropractic because it's not meeting that person as a whole. So I think it is looking at that person as a whole, not as the sum of their parts, which is that more reductionist approach.
Yeah.
That's probably my way of looking at it, my lens of looking at it.
Yeah.
But I'm always learning more, especially when I read philosophy books or something.
Yeah, well, the philosophy of chiropractic is it's an inside-out profession, although we're
above, down, inside out.
Above, down, inside out. We're adding an adjustment to that nervous system. One thing, and I get thanked all the time from practice members going, oh, thank you so much, Conor. you've helped my baby sleep through the night, the adjustments that you've given me have cleared my headaches. I haven't had a headache for 6 months. It's really hard to turn around to that person and go, it wasn't me that did that work. My role in your life is to find out where your nervous system isn't communicating as well as it possibly can, restore that communication pathway, and it's your body doing the healing.
Yeah.
We're not adding a supplement, we're not adding a chemical, we're not adding a medication. It's quite similar to exercise. You give them a plan or a course and go, hey, if you do this, your results could be this.
Yeah.
So it's really interesting coming from that inside out perspective of teaching the human body, you know what, you're in charge, you're healing.
Yeah.
I can't do that for you.
Yeah.
So that's kind of really cool.
I love how empowering that is when you're saying like it's that inside out and you're in charge, you're healing. That's what I like to say to my practice members is I'm not fixing anything. All I'm doing is getting your body into a better position to be able to self-heal and self-regulate. You know, like we get a cut, we don't have to do anything or take anything. The body's own innate intelligence is going to manage that. And that's the same as all of our other physiological functions. There's an innate program that's running that. We don't have to tell ourselves what to do, but it's when there's an interference to that has that trickle effect of where we start to see that symptomatology. So I think that's also how we as chiropractors view symptomatology. Like the symptomatology is not the problem. You know, we don't need to make the symptoms go away as such. We are recognizing the symptoms as a means of communication of where the body has got that interference, which is what we call the subluxation, sub being below, lux being light or optimum. I'm explaining it to you, but the people that are listening to us, and being a condition of less than optimum. So we know when the body has that subluxation that we lose that innate self-regulatory ability, and that's when we start to get the breakdown. So I think when we look at that translated into what we see in practice, like someone might present with, for example, a child that presents with, they might have had a fall or something like that. And the parents bring them in because they're a little bit worried that they might have, subluxated their spine or put their neck out. As parents often will say, I think they've put their neck out because they're holding their head funny. And as we kind of go through their health history, we realize that actually they're chronic mouth breathers. They're snoring. They are really picky eaters. They have like trouble paying attention at school. And, we start to see that there's a whole lot of other communication or symptoms that's presenting in their body. But their main complaint was they're holding their head funny because they fell over, right? So that's what their main complaint is. Yeah. So as we start adjusting them, we're not just treating the head neck being out of alignment. That's not what we do at all. What we're doing is we're going, okay, well, what we're going to do is we're going to remove that subluxation, like adjust that, introduce the adjustment, which is addressing that subluxation. We step back, right? That's our job done. And then it's up to that child's body as to what they then do when they've got that reconnection, that innate healing ability kind of kicks back into gear. And that's when we do like our progress exams, we see parents are going, oh yeah, and actually they've started to nasal breathe. They're not snoring anymore, and actually their palate's expanded. They can start to eat more things, and their teachers commented that they've gone up a reading level. I mean, how often do we hear these stories? They're so common, but that wasn't what people originally came in for. And so I think that again comes back to that holistic viewpoint, right? We're not treating anything, but what we are doing is we are taking into consideration how that interference is affecting that child overall and everything, because it's not just about the symptoms that they're expressing, but people wouldn't come and do anything about their symptom if it wasn't stopping them from doing the things that they love, right? Like that's such an important thing. And if a child isn't actually able to fully engage in their daily activities, whether it's school, kindergarten, daycare, whatever it is, if they're not able to engage in those activities well because these symptoms are holding them back, it's not like, it's bigger than just actually removing or like the symptom reducing because the body's actually starting to heal. It's bigger than that. It's how is that child able to navigate through their world? How are they able to relate to other children? How are they able to relate to their family? How well are they understood by their teachers? How well are they seen? It's a lot bigger than just, they don't have their head on an angle anymore. Yeah.
So one of the questions that I get from parents all the time, and this might be slightly topical, but we get questions about developmental milestones
Yep.
and primitive reflexes. Can you explain what those are? They're both completely different. And how do they relate to any underlying causes?
Yeah, okay. So I guess probably one of the biggest things to understand is that human beings are born developmentally very early compared to any other mammal. So you watch a calf that's born and it can kind of wobbly, get up on its feet, and it can find its mum and it can feed, and within a few days it's kind of keeping up with the herd, and a lot of mammals are like that. Humans are born pretty useless, right? We are entirely dependent on our primary caregivers for survival.
Until they're 28. Sorry,
Sometimes
Mum.
older.
Yeah.
So they're entirely dependent on the primary caregivers. Like, in a way, we're a bit more like marsupials than we are mammals. Like, we need to have our primary caregivers with us all the time in order to survive. We cannot necessarily be separated from them for an extended period of time. So the thing that makes us a little bit useless at birth is also the thing that makes us very human. So we are hardwired right from birth to connect with our primary caregivers. So that is very, very important, that our primary caregivers love us to pieces, and that we are able to communicate through cues to our primary caregivers for them to take care of us. So this is that kind of dyad, often between, biological mother and child, but it's, human beings are hardwired to form connections with a small kind of number of caregivers. It's not just mother and child. And that connection is what actually helps us develop all of our amazing human qualities. So empathy, forward planning, a lot of stuff that's associated with the prefrontal cortex that, allows us to be humans, okay? Yeah. But that happens over a trajectory of time and environmental inputs. So our brains, when we're born, we have more like brain cells or neurons than we will ever have throughout our entire life. We're born with the most. And what happens is that we have a selective die-off of brain cells because we start to form connections. So when we're born, there's not a lot of connections there. There is a lot, don't get me wrong, but we need to form these connections, and those connections happen from environmental cues. So we are born with what's known as primitive reflexes, right? And this is what we hear about, like retained primitive reflexes, and we hear about them as like kind of that they're a bad thing. They're really important when we're born. Like, we need them to land, and sometimes they don't land well, which means that we've got an interference to us being able to survive, because most of those primitive reflexes are associated with survival, and a lot of them are associated with the functions of breathe, suck, and swallow. So if you've watched, there's a really great film documentary about delivery self-attachment. Have you seen that one?
Not yet.
No? Okay, so that's where an infant is born with no intervention, and the primitive reflexes kick into gear. The mother doesn't do anything, she's just lying there. It's quite a peaceful birth, and the baby's able to kick into gear all of these primitive reflexes, navigate their way up the mother's torso and latch onto the breast.
Wow.
No intervention, right? That's a bit of a unicorn, doesn't happen very often. I had 3 home births and that didn't happen, but that's what our primitive reflexes are there for survival, for us to be able to do that amongst other survival things. So we need those reflexes to land. They're like our tree kind of roots, right? We need those there in order to be able to then progress on. So if you think about like concentric circles, the primitive reflexes are right in the middle. When we start to navigate essentially gravity, when we're in a gravity-based environment, we're born, we need to start to be able to, over a longer period of time than the calf, but we need to be able to do essentially the same thing. Get up, move ourselves around, keep up with the pack. If we were born at that stage, we'd be born at about 2 years of age. Well, That's not healthy for the mother's pelvis, nor for the child. So, from an evolutionary perspective, we're born a bit earlier and we are reliant on our caregivers. So what happens is through like a number of different environmental factors, we start to develop what's known as postural control or volitional control. So one of the first ones that we see is babies able to hold their head up. and then they're able to push up, and then they're able to turn their head without turning their entire body, and then they're able to, there's all these kind of layers of development, and this is what is known as the developmental milestones. We often just think about crawling as a developmental milestone, but there's a whole lot more that happened before then. These developmental milestones are essentially in place so that a child can navigate themselves through a gravity-based environment and form strong connections within their community, within their tribe. Like, we are hardwired for connection. Humans really do need other humans to survive from an evolutionary perspective. So that's the next concentric circle out. So we've got our primitive reflexes in the middle, and then we've got our postural development, or postural reflexes, postural control on top of that. Those postural developmental milestones put the lid on the primitive reflexes. We will always have the primitive reflexes in our brainstem, so the bottom part of our brain. And you see, like, if someone has a traumatic brain injury or something like that, you'll see them doing funny movements and head movements, hand movements, mouth movements. That's because they've had higher brain damage, which has meant that the brainstem is then expressing some of these primitive reflexes again.
Like a default
Yeah, it
mode.
goes back into a default mode, yeah. And so you'll see this with children sometimes as well. If there's been any sort of thing that's affected their brain in some way, you can see that they've still got these primitive reflexes expressing. So they're now not got the lid of the postural control. So the primitive reflexes still expressing themselves interferes with that child being able to essentially navigate themselves through a gravity-based environment and form connections and learn, which is then affecting their cognitive development. And so that's where we see a lot of information that's now, and it's really good that that's available, where they say, if you've got a retained this reflex, you'll show this. If you've got this reflex retained, you'll show this. It's because those primitive reflexes are kind of ballooning out and interfering with our cognitive development, because it's keeping us in that very infant state. And this is where it's, there's lots of different schools of thought about primitive reflexes. So essentially, use it and it integrates. That's the basic, right? We're born, we land, we need to use our primitive reflexes. We then respond to environmental stimulus, gravity, interactions, all the rest of it. That then develops the positional or postural control, which then allows us to go and learn and be humans, right? In an ideal world, that's the trajectory that we follow. But there are so many things that can happen in life, different traumas, so physical trauma, mental, emotional trauma, chemical traumas, what we talk about in the T's of chiropractic, that will interfere with that child developing along that trajectory. So it will mean that they don't necessarily develop their ability to hold their head up. That's one of the most important ones that we see as chiropractors, particularly if there's been any intrauterine constraint, birth trauma, inability to be able to latch and feed, any other sort of contributing factors that inhibit a child from activating the cerebellum, like midline cerebellar nuclei, which stimulate them to hold their head up and start to relate to how they move their eyes and then how they move their head because of the subluxation. That can then lead to them not putting the lid on those primitive reflexes as well.
Yeah.
Okay, so that's where we as chiropractors start to look at, well, what is interfering with this child being able to navigate themselves through a gravity-based environment and interact with other human beings and have that cognitive development. And that's that's kind of our approach to looking at primitive reflexes. There's lots of other aspects as well that have been well researched and evidence-based about, neurointegration exercises and things like that. But I think from my experience, having learned that and learned about the neurophysiology of chiropractic, if we have that disconnection and that subluxation and the brain doesn't know where the body is, it's much harder for those exercises that are designed to help to integrate primitive reflexes to land.
Yeah.
Yeah.
Well, that makes sense. Like, I do get a lot of parents just being like, can we test these primitive reflexes? The primitive reflexes. I saw it on Instagram, another mum talking about primitive reflexes, or in another group. In my less than 17 years of experience, the way that I've seen the biggest changes is through helping that nervous system communicate. I tend to view the primitive reflexes and those delayed milestones as kind of the fire alarm going off rather than the actual fire.
Yeah. Such a good analogy. I like that.
Oh, I love my analogies.
So
Don't
good.
worry, you're in for a treat.
Yeah.
And a big part of that is because, as you were saying, the brain develops bottom up and back forward as well. Like the last thing that's ever going to come online is that prefrontal cortex.
This guy up here.
In guys, that doesn't come online to at least 25, I'm pretty sure.
48.
That's when we know how to communicate. That's when we can talk to girls. But yeah, so it's really interesting to hear that perspective that it's a
I like to, when I've got families coming in that have found out about primitive reflexes and they're like, oh my goodness, my child's got all of these retained primitive reflexes because Instagram told me so. And a lot of that is driven towards like primitive reflex integration exercises, which are great. Like I will utilize them as well. The way that I talk about what is different about what we do is using Heidi's model of chiropractic, right? So the brain has a map of where the body is in space. And a lot of that we form in utero, you know, all those little kicks and things like that in utero, that's the brain actually starting to map where the body is. And so we need to be able to have full communication of our brain to our body and vice versa in order to be able to build that brain map appropriately and maintain it. So when we get an area that's not moving appropriately, that's where the brain forms a bit of a blind spot about where that area is. And so that means that we then don't move appropriately. Like we might get muscles that are overfiring or underfiring. We've got a joint that's not aligned well, so it's wearing unevenly. We've got, wait for that siren to go past.
Cops going through.
Cops going through. And we've got like the inability of the brain knowing where the body is and how to move it appropriately. So you can imagine that then has an effect on our postural development and us putting the lid on the primitive reflexes. So when I explain that to families, they go, oh my goodness, that makes so much sense. So I'm like, well, what my job is to look for where that interference is, to make the adjustment, and your child's body is going to do the rest. Okay, I'm not fixing anything. All I'm doing is helping their body to be more self-regulatory. As the twig is bent, so the tree grows. So if we are off on this developmental trajectory, we can bring it back into a midline. And that's sort of where I'll use what we understand about the current research in chiropractic and neurophysiology and how we apply that to people's concern about primitive reflexes. And I've kind of like, it would be really cool if we can just kind of like nudge Heidi and just be like, can we start to look at that?
Yeah, well that makes sense. So how, that neurospinal system works and how it functions directly puts input into the brain. And we want to make sure there's a good, clear input. If there's poor movement patterns, the brain's not understanding the map that it's supposed to be reading. That's where that confusion comes in, this disorientation, and then potentially some of those, I don't want to call primitive reflexes a symptom, but symptoms like the colicky stuff, behavioural problems.
Delayed
milestones. Yeah. Which is really interesting because that's exactly how I explain how the body and brain have this relationship to parents. My favorite analogy, if I can weave one in, is that the body is the wife and the brain's the husband. So you're at home. Who's the boss? There's no, So when there's a good communication pathway and your husband, your partner goes to the shops, you tell him to go get milk, he comes back with milk. If we've got this poor input to the brain, we're going to say, hey, we want milk, they're going to come back with bread. That's also because the brain thinks it's too smart. Just like any bloke, we think, oh yeah, great, well I got some strawberries as well because we got milk and for some reason I thought I'd put those two together and we're making pancakes. And you're like, what the hell?
I've just asked you for milk, it's not that hard.
Yeah, exactly. So when that body and brain have that beautiful connection, then we have this great...
They get the milk and the strawberries and the bread and they think of the other things and they bring home a little sweet treat and you go,
exactly. And they're coming home with flowers. That'd be lovely too.
Great. Yeah.
Courtney, don't you dare get any expectations.
Gavin, get lots.
Yeah. But because the brain thinks it's so smart and it's got all of these, all the connections, it holds all the information, I think that's where potentially healthcare gets a little bit confused. We're always looking at this brain to body connection. A lot of medications alter brain chemistry in order to change how the body's functioning. We kind of flip that on its head and go, the brain is, I like to describe it as a giant receptor. It will only ever do or respond to what the environment's doing.
Yeah.
If we can alter how the body is talking to the brain, give it better environmental signals, the brain's going to understand where it's at. It's going to know what's going on. It's going to be able to calm down and regulate better.
To receive and interpret those environmental signals. And this is where, coming back to like the primitive reflexes thing and any other sort of like integration exercise that families might be prescribed. And I've worked a lot with OTs as well, which I love. I love working with OTs. And they'll give families exercises, integration exercises. When I say integration, it's integrating primitive reflexes. So that's what the reference is there. There is this ability for those integration exercises to be able to work more effectively because we have that cleared communication pathway. Because if we're trying to do an integration exercise and the body and the brain have that disconnect, you have to do that so many more times for it to even make that neuroplastic change. Whereas though if we, and this is one of the, a lot of the studies that have been done in sports chiropractic, right, and about muscle firing and activation in adjusted and non-adjusted populations. And we're going to have to probably reference this at some point, but I can't remember off the top of my head, that in the adjusted populations, we had more adequate muscle firing than in the non-adjusted populations, which means that the exercise is going to be learnt better because there isn't that interference there. And so that's the same as what I see when we're working with families that have got other prescribed exercises, integration exercises from the OTs that they're working with, is that they work far more effectively once they're being adjusted. It's just expanding on that sort of brain having that much clearer communication with body. It just lands better.
Cool.
Yeah.
Occupational therapists, speeches, you've mentioned dentists.
Yep.
Who do you love to work with and how do you add value to them
All
and
three.
their clients? Are those the three main
more
ones?
I used to work across the hall from art therapists as well that worked a lot with kids in terms of like helping with trauma integration and things like that. And we know a lot now about how the body stores trauma, and particularly in children, we have what's known as implicit and explicit memory. So, something can happen to a child that's really traumatic, or even like lots of little micro traumas, and they don't have that cognitive ability to be able to understand that, but their body knows the feeling, right? So there's a part of their brain that will, this is the essentially the neurophysiology of trauma, that will remember, and that then kind of creates the neurochemical cascade in their body. So when we work with children that have got these stored tension patterns, they respond better to things like the integrative art therapy, movement therapy, things like that. So it's not just about the dentists and speeches and the dentists I love working with, particularly like dentists that are getting on the bandwagon about holistic management, because in a lot of dental studies, this is just from communications with dentists who are friends, by the way, I'm not an expert on this, but in communications I've said, we're not taught to look at the whole body, we're taught to look here, and we're not taught to look at how that affects everything else. So once they're out in the world and they have their experiences, they go, oh my goodness, like the mouth affects everything else, and then they start to go, wow, like we need to look at posture too, because I can't influence the jaw function if I don't look at posture. And, there's that flow-on effect. With the speeches, there was a few speeches I really love working with where they understand that the mouth takes up such a huge amount of brain real estate. And if there is any interference to that communication, then again, the exercises or what they're trying to introduce aren't as effective. So that that if they refer to the chiro is going to be able to help to reduce some of that interference, which is then going to make what they're doing in terms of exercises and therapy be far more effective because we've got that cleared pathway of communication. And it's the same with the OTs. Like the OTs, just like I've got quite a few. Like I have had quite a few OT practice members as well, and they're just like, oh, this makes so much sense, to be able to, remove the interference to the body, then being able to do the exercises really well. It's going to actually create more permanent neuroplastic change because the brain's not having to deal with all of the other noise that we know that subluxation can cause. That's what's shown in a lot of the neurophysiological research around chiropractic is the amount of noise that's created in the brain when we are subluxated. When we don't have that subluxation, we have less noise. We're more able to do an exercise that the OT has prescribed or, activate something in terms of the speech. We're able to elevate the tongue finally because we've got no interference to that ability to be able to elevate the tongue, or we have more activation to our jaw musculature. So we're more able to, handle different food textures or, there's so many different professions that I love working with because I know what I can do well and I want to concentrate on what I can do well. And I want there to be able to be access to these other professions that they do what they do really well, that we all are able to enhance that individual's health journey. It's so good. I love that. I love working in big integrated practices, and I have the honor of being able to teach the oral motor function, which is essentially what happens in the brain as all of these kind of oral motor reflexes come online. And it's really great because I get to be able to stand up in front of a room of chiros and speechies and dentists and physios and people, and we're all talking the same language. We're all about the same thing, and we're all about optimizing that person's health expression. And I have these aha moments when I hear dentists talking about a certain thing that they're doing to be able to expand a palate in this way, which is now enabling this to happen, and they do this, and I'm just going, oh, that's so cool. That means that person's not going to continually be subluxated in the same way because you've actually removed the physical trauma that's contributing towards them developing that same subluxation pattern. I'm getting a bit technical now, but I love being able to work with lots of different professions and realise that it's not an us versus them thing at all, ever.
Never has.
Never has been.
Never has.
Yeah. It's not been, I think it was challenging when I worked in New Zealand. I was in an integrated centre, and so there was doctors and dentists and art therapists, counsellors, psychologists, specialists, all the rest of it. And a lot of them were practice members, and they loved it, and they love what I do, and I'd have really great animated conversations in the lunchroom with them, and then other ones wouldn't even acknowledge me in the hallway.
Yeah, interesting.
Because I was a chiropractor.
Yeah. And
I'm just going, oh, if only I could talk to you as a human to a human, and you could hear my passion for what I do, my understanding for what I do, and my desire to be able to know what I do really well, just like you do.
Yeah. Well, and that's ego getting in the way of clients, patients, practice members getting better results, which is detrimental to everyone. Mm-hmm. If we didn't know great paediatricians who are helping people, we would never be able to access and support these families. They'd never know about us. They'd never know that that body-brain connection is so vital. And it's really interesting when you're talking about the orofacial control and change. A lot of people probably just don't realize that all of that still has to go to the brainstem before it can go to the brain. Mm-hmm. So there's still a really big relationship between what's happening up at C1 and C2.
Oh, huge.
And well, plus the rest of it, because it's all afferent input, or A for up is how I like to do it. It's like the old New Zealand O for awesome TV show. That's how I remember how it works. And things like the vagus nerve have to all run through mechanically through that area too. So it's really interesting how much C1, C2, brainstem, orofacial, well, and then brain development all sits and overlaps so well, which creates the neuroplasticity in there too. So that's kind of nuts. So who are you the right chiropractor for?
Interesting enough, because I would say I'm the right chiropractor for families whose, they're wanting their children to develop optimally. Like they, may have had some interference at birth, or they might have some difficulty with latching and breastfeeding, or they might have some, developmental concerns, not necessarily meeting developmental milestones, or behavioural challenges, or airway breathing challenges, jaw grinding, snoring, chronic respiratory infections, like, anxiety, or, like I can kind of like put a list on some of the presentations. And then all of a sudden the universe will send me a curveball of like a 70-year-old woman coming in with vertigo, right? And I'll be like, hey, I can actually understand what's happening in your nervous system here, and let's just adjust you and see what changes and have amazing results there. Or, an interesting one, veterans with PTSD, having a profound change, and when they're actually able to release some of that stored trauma from their body, having a really good change. So if I'm the right chiropractor for, I always think that the right people will find me. I've done a lot of specialty work in neurodevelopment, paediatrics, that sort of area, but those are transferable skills to the people that I meet that book in. I did do that. I used to just see only young people, and I realized I was missing that lovely, good, broad cross-section of my community. Like I like being able to have a chat to somebody that I'm sitting next to when I'm down at the beach, and they find out that I'm a chiropractor, and then they go, oh, like I'd love to book in. Like that's a nice experience to be able to just show up at the right time in the right place for the right people. Yeah, and I've realised now, having been in practice for a wee while, that I never have to hustle, because the right people come in, and I'm not everybody's cup of tea. That's fine. I probably take a little bit longer with my appointments sometimes, which for someone that's wanting to get in and out might not necessarily serve them well. I do a variety of different techniques. So I'll do like some manual adjusting, but I also do a lot of cranial work as well. So it depends on what the person's presentation is. And this is why I like working within Healing Wave as well, is because you've got, like, how many different chiropractors are there? There's so many, right? I think
we're up to 14 or 15 now.
Yeah, 14 or 15 chiropractors, all within quite a relatively small radius. So if I'm not necessarily the right person for the person that's on the table, then I'm like, hey, actually, I think it'd be really good if you saw Maddie, because, she's really good at this. Or, you go and see, Craig down the road, or something like that. Like, we've got so many of us that we can actually, and such a diverse amount of skills and experience, that people are going to find and settle with the right people. It's not.
Yeah. What you were saying before with having that, I guess, expanded view of a practice and a practice member. Some of my favourite adjustments are, I've got a family, Nana or Grandma brings in the grandson, and then on the table next to them is her son-in-law, and it's like, how funny was that? And they didn't even know that they both came and saw me until they were in, and they were like, what are you doing here?
Yeah.
and just those little community aspects as well, and seeing the whole family, and so seeing cool. Grandma, mum, and
I think the best one was so cool. I had 4 generations.
Oh my gosh.
When I was in New Zealand, there was a family. It was 4 generations that all come in at the same time. It's so good.
Yeah. And even when I was at Warners Bay, I had a whole 3 generations. I actually played against some of the guys in soccer. I take care of their parents and then their grandparents, and then sometimes come in and go, oh, how's mum and dad going? I'm like, I don't know, talk to your talk to your family.
Oh, funny.
But no, it's really cool.
Yeah. So in answer to your question, I have kind of created a bit of a niche about what I do in terms of like the orofacial development, neurodevelopment, airway, behavioural, things like that. But I love seeing a cross-section of my community. Yeah. This is why I'm excited about being in Newcastle, because I live here. Like, my kids go to school here. I go to Pilates here. I'm here.
Yeah.
Yeah. So that's why it's really exciting to be here in my community.
Yeah, well, and you're down at the beach often.
Yep, every
day, going for a walk. I've seen you down. Every time I go down to the beach, I'm always like, oh yeah, Sam's over there. And I've seen you at Newcastle Beach, I've seen you at Nobby's Beach.
Yeah, I do the walk with my dog every morning. I go down Horseshoe and then round Nobby's and then round to Newcastle. So
perfect.
That's my dog walk.
Yeah. and then you're in the area, your kids go to school in the area. It makes sense for you to be here, and I think what we've been trying to achieve and the values that we've been trying to purvey to the community have been how can we help people regulate their nervous systems, feel and function better, and have as much life in their system as possible. I think that the tagline for Healing Wave is more life, and I think that's a really interesting viewpoint, because life is different for so many people. I've got young guys that are having families. I've got older ladies playing golf. That's their version of life, as they're trying to express as much health and vitality as possible, and it comes out in different ways. It's the mum that wants her kid to sleep through the night, and then she gets to sleep through the night, and then they regulate better together, and
adolescence.
Everyone's change.
I think that's also a phase of life that I'm in. I've got a house full of teenagers. I love checking adolescents. They're going through a massive brain remodeling. Again, sort of understanding about what's actually happening in their brain is so great. And I love being able to support adolescents through that whole, what we call the brainstorm of adolescence. Working with teenagers. And again, for all sorts of things, whether it's like high performance, like they're athletes, because a lot of times it's when they're sort of really getting into high performance, high academics, performance in creative arts, my experience as a teenager, and you've related the same thing of how you felt just more full of life. Like as a teenager, you can't necessarily explain it, but the adolescents that I see love getting adjusted. They're like, I don't really get what you're doing. I don't really want you to tell me about it, but just can you do it because I feel better and I play soccer better, or I'm able to play my musical instrument better, or I'm able to focus better for my exams, I'm able to be more creative, I'm able to be more calm and regulated. That's a big one. Or I notice I don't feel like I want to play my video games as much. I notice that I actually feel like going out and getting outside, and you're making me go and exercise again, or you're making there's that surly kind of reluctance to doing the little things that we plant the seeds about changing the behaviours that's going to support them in their brain development. And so I really love seeing and relating to adolescents as well. I think that's, again, my phase of life that I'm in. I've got a house full of teenagers, and I love it. Like I haven't found a teenager yet that I haven't enjoyed working with. And I had one young boy a long time ago who you've watched Hunt for the Wilder People, I'm assuming? Yeah, okay, yeah. Well, he was pretty much Ricky Baker. And this kid just loved getting adjusted. He was in all sorts of other trouble and challenges in his life, and he had this really traumatic upbringing, and he was fostered, and but man, he loved getting adjusted, and man, it made a difference to how he was able to, just regulate himself, be able to show up at school, be able to get himself out of bed, be able to he was able to put into place, because he was working with a counsellor and therapist, he was able to put into place some of the practices that they were trying to educate him on, because his nervous system was a lot more regulated. So I think that no one else wanted to work with this kid. It was just, and that was really rewarding. I loved that. It was really cool. So yeah, I like working with adolescents. I've had adolescents that have gone, they're really high performance athletes in different sports, and they're lots of fun, because I explain to them, you're performing at a level that your body's not yet at capacity to hold. So we're pushing it to the end stage of adaptation, hoping that it's going to recover enough that you continue to grow well. And you're not super healthy just because you're the absolute best gymnast or you're absolute best at name your sport. It's actually that we're just hoping that your body adapts enough that you still develop well, because you are pushing it to the end stage of adaptation with what you're doing as a high performance athlete. And I think, parents particularly kind of go, oh my goodness, they have this perception that because their child is a high performance athlete, that they're really healthy. But when we start to adjust them and we realize where they're not necessarily really healthy, when we've done scans, I've done scans in the past, and we show actually this nervous system is really, really stressed out.
It's redlining.
It's redlining everywhere. But they just won a national title in this, and it's but look at the cost that it's having. If we can mitigate this cost, you imagine how much better their performance and recovery is going to be. You imagine that they're not then going to hit 40 and need surgery because they've worn everything out. Yeah, like it's kind of, I really like working with adolescents. Yeah.
Well, a lot of chiropractic tends to be the connection to self. That is a big part, and that inside out philosophy of connect that nervous system, allow the body to express itself in those formative years is so important, because we're always talking about getting to know yourself. Who are you as a person? Those are those questions that you get through those years. If you're able to understand how your body moves and functions and feels and how it interacts, and having good sleep, that personal connection to yourself allows you to have other connections outside as well. Absolutely. Which is really important. Those are the years where a lot of people do find their tribe and find the people that they're going to resonate with for a long time. Especially high school years for me was super important for finding good friends and having connections for life. I was just at a high school friend's wedding, and it felt like it was 20 minutes since the last time I saw them.
Yeah.
Like those are the connections that you get when you've got a nervous system that functions how it's supposed to, and you can regulate, because then you foster those lifelong connections as well, which is so abstract in the whole realm of what chiropractic is about, but really cool to reflect on that from my personal experience, because would I have been friends with these guys in high school if I hadn't been adjusted and felt like I've got the energy to be able to communicate? Probably not.
It's big, isn't it? It's really massive, yeah. And it's interesting when you're looking at adolescents who are, so I've got one of these where, so my children are hypermobile, ironically, the chiropractor's children, so am I, it's a genetic thing. And so I've got one daughter that does the cracking her knuckles, right? I notice that she will do that more when her body is storing more tension. Like she's more
releasing.
So it's like a little cue for me. I'm like going, okay, like she needs a little bit of extra help right now in terms of me checking her a bit more regularly, because of this, she's sort of like going through quite a bit. So I think that it's like subtle things in adolescence have a huge effect. How many times have we, x-rayed people in their like late 20s, early 30s with a raft of complaints? Yeah. And we see their spines on x-ray and we go, oh my goodness, like this is like quite a lot for someone that's quite young. Tell me more about what you did as a teenager, as a child. And they're like, oh yeah, played footy, heavy tackle, smashed myself, was really stressed, high, played a lot of computer games, like we see the effects of the choices that they were making without having a fully formed prefrontal cortex as adolescents, without necessarily having the support of chiropractic. And then they reach that age and the damage is kind of done. Like, yeah, sure, the body has got amazing healing ability, but if we can mitigate that damage in that really important phase of life and be able to just plant little seeds about them being able to take care of themselves, because that's what my chiro did, just kept planting little seeds about things, Like, remember him kind of pulling me up about my sugar consumption. I kind of went away and I thought about that a little bit, like pulling me up on my alcohol consumption as a teenager, and I went away and thought about that a little bit. And it plants those little seeds that mum and dad aren't able to plant. They're not programmed, they're not wired to listen to mum and dad. But if we can plant little seeds with them about how to look after their well-being overall, I think it makes a big difference. And then we don't see them at 25 to 35 with massive postural dysfunction
and then that costs
degenerative change and
so much more as well.
It does cost so much more.
Like we end up having to program them or schedule them heavier. And it's the twig analogy that you used before. It's easier to straighten a twig when they're in that when you're a lot more neuroplastic, and it takes less time, less money, less effort when we're at that earlier stage. Yeah. We probably need to wrap this up now, but
do you want to talk about the mouth matters?
Exactly. Yeah. So you're hosting a Mouth Matters workshop on the 17th of February here in our Newcastle practice. It starts at 6:30. Can you tell us a little bit about that and why that's important?
Okay, so it's important across all age brackets. So let's start right from very early on. infants. It's a lot to do with essentially what I said earlier about how the mouth and all of the structures in and around the mouth take up a huge amount of brain real estate. So important. So when we are born, we're born with a lot of primitive reflexes, and they're essentially associated with breathe, suck and swallow and other survival kind of reflexes. And so it's about understanding how they're working in infancy through development, right from latch. We'll talk about issues such as tongue tie, what that means, what it is, and, like looking at what the current evidence is around that. We're looking at the things like breastfeeding, bottle feeding, introduction of solids, picky eating, speech development, obligate mouth breathing, the snoring, chronic respiratory infections, tonsillitis, adenoids, like we're going to be looking at that speech development. So a lot of it's relating to that childhood development, but we're also going to look a lot about how what happens in the mouth affects how our brain functions as well. So it's huge. It's really, really huge. Yeah. And this is not only just for, children. It's about, adolescents in terms of brain focus. It's about people with TMJ challenges. It's about, people undergoing orthodontic care and, what else can we do to support the system through that. It's also about, stress for adults. It's a massive one. And we're also going to talk about things like in terms of the elderly. So one of the biggest things is if we lose our ability to manage a bolus of food, that's where health significantly deteriorates. And so a lot of it's going to be about how essentially the brain and the mouth are connected and how we can support those connections in order to be able to optimize our expression. Yeah. It's going to be, I really encourage a lot of families to come along to this, but again, it's sort of open to everybody. I'm going to touch on all of these different topics. I think the biggest thing is about having an understanding, because so many people, the reason why I'm excited and motivated to do this talk is I get practice members come in with XYZ presentation, and it's always got at least something to do with the mouth and the oral structures. There's going to be an influencing factor about the mouth and the oral structures. And they go, oh my goodness, I never knew that. So I'm trying to target the, oh my goodness, I never knew that with this talk. Really important things that developmental milestone that's really important that we don't talk about enough. And for example, pacifier companies don't put little warnings on their pacifiers that children should developmentally go from sucking to chewing at about 4 to 6 months of age. And if we miss that milestone, it can cause huge amounts of detrimental kind of flow-on effects. And I mean, you see kids, walking around with pacifiers, they're walking, they shouldn't have a pacifier in their mouth. But again, people aren't made aware of this. There's no little warnings on the pacifier things. You don't necessarily get told this by your childhood nurse. You don't necessarily get this education until they get to the dentist and they've got this huge open bite. And the dentist is like, oh, well, you kept them in a pacifier too long, almost shaming the parents about it. Yeah. And it's like, oh my goodness, no. If we can have a bit more understanding and education around this whole structure, how it develops and how to support that development, then that's a success. So that's what this talk is aimed at.
It sounds like the way that you describe how important it is with these kids and toddlers, that if they get a better head start, their family is going to save thousands on their dental and orthodontic bills.
Yeah, and their chiropractic bills, because they're not going to resupplicate all the time. Yeah.
So for the $10 that they're going to spend to come to your talk, they're going to get potentially thousands or tens of thousands of dollars of value from not trying to throw any dentists or orthodontists out of business, but I'm pretty sure they'd like less work and less heavy
But it's also
lifting.
Understanding, not necessarily less work, but there's a lot of dentists, there's a lot of kids that I work with that there is they have dysfunction and they have an underdevelopment of the middle third of the face. So I talk to the families about this is what we're going to do to mitigate some of the damage and to really improve our outcomes. I suspect that you're still going to need to work with a functional dentist at some stage, just because we've got, in chiropractic, we talk about limitations of matter. Yeah, we have a limitation of matter. We can get the best that we can with what we've got. Yeah. But I anticipate that we're still going to necessitate working with a speech feature. We're going to necessitate working with a dentist.
Yeah.
So it's actually about, there's a lot of things that we can do to avoid going down that trajectory or to like lessen the damage, and also to kind of set them up for when they do need to go and see a dentist, that they already have improved some of that underlying dysfunction that caused the crooked teeth in the first place.
Yeah.
You know, if we get them kind of, get everything activated and online, they're going to better respond to what the speech is going to do with them. So it's not a let's avoid these other professions. It's about let's have an understanding of how this whole system works and have in mind, I've got an infant now, but I've got in mind I'm probably going to need to take them to a functional dentist when they're about 5 or 6, or, for example, so that people know what they're in for and how to best support their child.
Cool.
Yeah.
All right. That's a wrap.
Yes.
I think
Did
we've
it.
nailed it.